Till 9 o'clock this morning. On Breakfast this morning, we're looking at what's being done to try and improve the lives of people suffering from Lyme disease. In the fallout of a protest outside the Department of Health last week, a Teesside woman has told BBC Tees that contracting the disease as a child has broken her family. Sufferers of the disease are arguing that the NHS is failing to diagnose the illness properly. Before we get to the story of Adele Hoskins from Redcar, I want to put you in the picture as to what the disease actually is. Well, our reporter Paul Baird has been taking a look for us.
Lyme disease is an infectious disease caused by at least 3 species of bacteria belonging to the genus Borrelia. It's named after the towns of Lyme and Old Lyme in Connecticut, USA, where a number of cases were identified in 1975. It's transmitted to humans via the bite of infected ticks belonging to a few species of hard ticks. Symptoms include fever, headache, fatigue, depression, and a characteristic circular skin rash where the person's been bitten. Left untreated, later symptoms can impact on the joints, heart, and central nervous system. In most cases, the infection and its symptoms are eliminated by antibiotics, especially if the illness is treated early. As we're learning here in the UK, there are some who feel that simply isn't happening enough. Campaigners say there are up to 3,000 new cases a year, but due to misdiagnosis, that could be far more. Lyme Disease Action estimates a truer figure could be around 15,000. Currently, there are no NHS specialists in Lyme disease, with most doctors having no specific training.
Paul Baird there. Well, Adele Hoskins is live with me on BBC Tees this morning in the studio. Adele, good morning to you.
Morning.
You've told BBC Tees that this disease has broken your family.
That's right.
Can you explain how?
Basically, because it's gone undiagnosed for so long, we've had to go private. So we've had to give up the house, move in with my parents. We've sold our family belongings. We've got no independence, and we've just lost all sense of identity as a family.
And explain how Lyme disease has done that to your family situation.
It's because we have to raise the money to go private because the NHS don't recognise it. So we've had to give up everything in order to try and fund some of it ourselves.
That must hurt, does it?
Oh, it does. It has broken me.
The impact, I can hear the emotion in your voice, the impact it's had on your family life. Mm-hmm. It's been devastating.
It has. I mean, we've managed to get Caitlin tested. We've raised the money for her. But, I mean, having to decide which child to take because you've only got the funds to take one to be tested is absolutely horrendous. I wouldn't wish it on anybody.
How can you make a decision like that?
It broke me. Basically, we had to choose the most symptomatic child to take, and we're still yet to raise the funds to get the other 2 tested. But we went on symptoms. Caitlin was had abdominal pain every night. She couldn't eat properly. She had anemia, growth problems. So we chose Caitlin.
How old are your daughters?
I've got Caitlin, she's 7, and then I've got Joshua, who's 10, and Dexter, who's 2.
Okay. And what do they say to Mum about the condition?
What do they say to me?
Yeah.
They want recognition. They're broken too. They can see the effect it's having on me. Yeah, it needs sorting.
Do they understand what it is?
They know that Caitlin knows she's got Lyme disease and co-infections that go alongside it. But they don't know, how complex it is. No.
Do you feel? I suppose guilty is the word as a mum, do you?
Yes.
You're nodding at me.
I mean, that's what I put on my protest picture, that even with all these symptoms, I've lost my gallbladder, bronchitis, muscle twitches, palpitations, but that's my worst symptom, is guilt. As a mum, you should be able to fix your family, and I haven't got the means to fix my family.
What's your experience been like with doctors? Talk us through what that's been like.
In
what way?
Very closed. As soon as you mention Lyme disease, we've been referred to an infectious disease specialist, and it's straight out no, you haven't got this disease, because their tests come back negative, and their tests are no better than a coin flip. They miss more than 50% of the cases.
So that for you, that's simply unacceptable.
Yes, of course. That's why we keep rallying. That's why we went to the protest. Things need to change.
And you firmly believe this is from something that happened to you when you were a child?
I do, yes. I was bitten by a tick when I was 11, and I remember the classic bullseye rash, although not everybody gets that. But at the age of 11, I was told that it was a reaction to an insect bite, and I didn't know any better then. But yeah, that's led to a catalogue of health problems over the past 20 years.
Did you get any treatment at the time for that then?
No.
Nothing at all?
I came back from Germany. I got bit in Germany, and I took very ill, rushed into hospital. They thought I had appendicitis. I didn't, but they took my appendix anyway. It took me a long time to get better, and I've had times where I've been really well, and then it flares again. So yeah. Horrible situation to be in. Horrendous.
You could never imagine the impact that it would have on your entire life.
No, not at all.
How much is the private treatment?
You what, sorry?
The private treatment for this? Is it expensive?
It is expensive. I mean, it's probably about 1,500 every month and more. We're on antibiotics, supplements. We have to be tested every 8 weeks to see that the treatment's working. Yeah, it's a lot of money. That's why we've given up the house and sold the belongings.
And you're completely drained by all of that, yeah?
I mean, I'm having to front the appeal while not being well myself. It's draining.
Yeah. Stay there if you would. If you just put your headphones on, because listening to that is Stella Shires, who is Chair of the Lyme Disease Association. Stella, good morning to you.
Good morning. Lyme Disease Action.
How common is Adele's story?
Well, we hear quite a lot of stories in a similar vein, but of course you have to remember that we only hear the difficult cases. People who are identified and diagnosed and get treated successfully, we don't hear about. So it's very difficult to say what proportion of people go undiagnosed. But we do hear about a lot of people who are told, you've had a negative blood test, therefore you can't have Lyme disease. And that is untrue.
And that's unacceptable again in your eyes, is it, Stella?
It is unacceptable because the research literature does document that the tests are not perfect. There's no test in the world that can definitively tell you that you don't have Lyme disease. People have been searching for it. The NHS is currently trying to evaluate other tests, which is a recognition that the existing ones aren't perfect.
You just have to listen, though, to Adele's story. Adele herself, she said in her own words, is desperate. There was this protest last week. Do you think that was justified? Will it achieve anything?
We don't know whether it will achieve anything. It has certainly raised awareness of the disease amongst a lot of people. We run a patient help email line, and as a result of the publicity to the protest, we have had inquiries from people who've said, I've had a rash like that. Could this explain all my problems?
And where exactly do you think things are going wrong now, Stella?
Things are principally going wrong because the correct information about the disease has not been cascaded down to doctors. So doctors believe what they've been told in the past, that the tests are nearly perfect and that a short course of antibiotics can cure Lyme disease. Now, it might be able to cure early Lyme disease, but the research shows that we do not know the appropriate length of treatment or the right antibiotic for Lyme disease that's been in a patient for some time, so more than, say, 6 months. Let alone years.
Okay. Well, Adele, you described your relationship with doctors as closed, didn't you?
Yes.
And from there, it's something that you clearly think that doctors need to know a lot more about.
They do. They need to be made more aware of the condition. I think they need better education, definitely.
Stella, you've had your own battle with the disease as well.
Yes, I have. I'm an example of a person who had a characteristic rash, didn't think much about it, eventually went to a doctor who didn't recognise it, and it went undiagnosed for 3 years, thus making it a bit more difficult to treat. There are lots and lots of people in that position, many of whom are only just now seeing pictures of the rash on newspapers, in journals, in magazines, and thinking, oh yes, that explains it.
So you've got to be so careful when you're out and about walking then, yeah?
Well, you have to be aware that we need to go into the countryside. It has a lot of health benefits, gives us the benefit of exercise, and it's a wonderful place to be. But if you know there might be ticks out there, then you need to check yourself when you come back. They're easy to remove. You need to remove them properly with a tick removal tool. And then you have very little danger if you take them off quickly.
Okay.
But it's important to check yourself, particularly children, small children, who are often bitten up around the hairline, which is a place that it's quite difficult to notice a tiny little tick.
Stella, thank you for talking to us. Stella Hewish-Shires, Chair of the Lyme Disease Action. We have a statement from the Department of Health. The spokesperson has been in touch with us here at BBC Tees to say Lyme disease can cause serious and long-term complications. That's why we are working closely with Public Health England and NHS England to raise awareness amongst doctors and nurses, and are using the latest world-class diagnostic testing to look at the disease in patients and those with symptoms. Public Health England has guidance available for use in GP surgeries, and there's also a Lyme disease helpline that doctors can call if they spot symptoms and are unsure of what to do. What do you make of that, Adele?
That'd be great if there is a helpline, but, you know, when I went to the doctors about Lyme disease in the first place, they never asked. They never phoned a helpline. There was none of that. It was just the test is negative.
So what next for you, briefly, in the family?
Keep plodding along, try to raise funds. We've got a raffle for Ollie Murs tickets. It's all, if you search on Google for Huckins Family Appeal, we're on there if anyone wants to chip in.
Keep it in the spotlight, yeah?
Yeah.
Best of luck. I hope things get a lot better for you.
Thank you
deserve
very
it.
much.
Adele Hoskins with us at BBC Tees this morning. 8 minutes past 8. Let's have a look at...